Good afternoon, everybody. My name is Darryle. My refutation speech today is in response to the advocate's factual major claim that animal testing is not necessary in order to have safe products. My refutation major claim is animal testing is necessary in order to produce safe products. Using animals in research is a concern to some. However, the benefits derived from the ethical, humane use of laboratory animals for biomedical research are huge. Nearly every major medical breakthrough in the last 100 years has been achieved by research with animals. The advocate's first secondary claim is that animal testing is harmful to animals. Life of an animal in a laboratory is short and painful, and they have to deal with torture daily. My secondary claim is animal testing is not harmful to animals. Research animals are protected by a host of state, federal, and international laws. It is estimated that less than 0.5% of research animals are dogs, cats, and primates. According to Americans for Medical Progress, AMP, more than 95% of research animals are rats, mice that are bred for research studies. In California, the American Association for Laboratory Animal Science promotes the safe and humane treatment of research animals in hospitals, universities, and research centers statewide. The advocate's secondary claim number 2 states that animals are not human. My secondary claim states animals are similar to humans for testing purposes. According to procon.org, animals are appropriate research subjects because they are similar to human beings in many ways. Chimpanzees share 99% of their DNA with humans, and mice are 98% genetically similar to humans. All mammals, including humans, are descended from common ancestors and all have the same set of organs: heart, kidneys, lungs, etc. Because animals and humans are so biologically similar, they are susceptible to many of the same conditions and illnesses, including heart disease, cancer, and diabetes. Without animal research, millions of dogs, cats, birds, and farm animals would be dead from more than 200 diseases, including anthrax, distemper, rabies, feline leukemia, and canine parvoviruses, according to Americans for Medical Progress, AMP. In human terms, research with animals has led to vaccinations against smallpox, measles, mumps, diphtheria, and tetanitis, development of anesthesia, antibiotics, and insulin. There is no adequate alternative to testing of a living whole body system. Living systems like human beings and animals are extremely complex. Studying cell cultures in petri dishes, while sometimes useful, does not provide the opportunity to study interrelated processes occurring in the central nervous system. The advocate's claim number 3, secondary claim number 3, is that there are other alternatives, methods of testing products that are cheaper and more accurate than animal testing, and animal testing is expensive due to housing, feeding, and caring for. My third claim is that testing on humans is more expensive than testing animals. In 2013, the biopharmaceutical industry sponsored about 6,200 clinical trials of medicines in the U.S. Involved a total of 1.1 million participants. Trials occurred in all 50 states and the District of Columbia. The biopharmaceutical industry spent nearly $25 billion directly in the conduct trials across the U.S. in 2013. According to PETA's website, annual animal testing is about $12 billion, which is less than half of the human clinical trials in 2013. So, in conclusion, animal testing is necessary in order to produce safe products. There are 3 claims which support my argument. First, animal testing is not harmful to the animals as safeguards are in place. Second, animals are similar in genetics to humans, which makes testing more reliable. And third, the cost for human testing is much more expensive than animal testing. Thank you for that.
Thank you. All right, well, you set up the advocate structure, and as you get to each point, you basically replace their claim with a counterclaim on the individual points, which is not a bad idea, but it does immediately suggest that you're doing very little to look at the evidence and the research and the reasoning that they use to arrive at their conclusions, and instead you're going to rely on rebuttal kinds of arguments. I think the first argument was pretty effective when you're talking about the number of animals that get used and the kinds of animals that we're dealing with. I think that that's helpful in the sense that it kind of puts it into a different context than what the advocate might have been suggesting. The notion that the animals have to be treated in a particular manner, you've got a very generic piece of information about what California might encourage or incentivize, but that doesn't really tell us about all the multiple layers and laws and policies and procedures that scientific and academic organizations might have to follow, or, for example, the evil pharmaceutical corporations that everybody's always pointing their finger at, that they might also have to follow. I think that if you had something a little bit deeper on that, that would help answer that point. The second point deals with, again, the kinds of animals that we're looking at, and the kind of and the similarities that they have to human beings, why animals are necessary. I thought you did an interesting job here suggesting why we need to have animal research for things other than human benefits, and you mentioned animal benefits as well. I thought that was an interesting counterclaim, that animals in essence benefit substantially from this kind of research, and then you've got a whole list of diseases and problems that animals suffer from that are addressed by the research that's been done on animals. We don't really have much quantification about what the impact is, how many cases of rabies have been prevented, how many parvo illnesses have been avoided and lives saved as a consequence, but you give something to weigh on the other side there, so I thought that was okay. Although, again, I'm not sure that it directly addresses the advocates' and information and arguments there. I was a little confused because the last thing that you talk about is how cell cultures are not really adequate substitutes here, and that seemed to me like it would go into that third point when you're talking about the alternatives. It's maybe a bit premature to have it in the second point. It would make more sense to be in the third point. The one thing that I thought was especially effective here is the demonstration that there is a substantial amount of human research that's going on, that there are lots of people who are involved in this research, so it's not as if the burden is all on animals and humans don't bear any of it. But I thought that the way you went at it was kind of directed at the advocate's position, which was how costly it was. And you're saying, the human research is more costly, and we still do this because there's some value in producing those results. I thought that was an interesting comparison. That's the first time I've actually heard somebody tell us what the actual costs were, so I thought that was effective also. I do think that you need to kind of engage the advocates' arguments a little bit more. The rebuttal arguments are fine, but you probably want to make sure that you have a multiplicity of responses and work on talking to the audience a little bit more, reading a little bit less. Thank you.